42, is this the new guy?
Yes. Carter.
Hi, how are you?
Dr. Nicole Sinclair is starting her 24-hour shift on the pediatric floor at Covenant HealthCare.
And when did they give him his last breathing treatment?
About 7 o'clock.
At 7 o'clock.
Dr. Sinclair is looking for clues as to why Carter is having trouble breathing.
Does Grandma have any dogs?
No, but she has 2 cats.
Oh.
He was kind of congested and a little coughing, and then Monday morning he looked like his breathing was a little, like he was working to breathe, so that's when we decided to bring him into the ER.
On the left, I can hear some wheezing, so what we're going to do is we'll give him another breathing treatment, and we'll put him on some steroids as well, and that'll kind of heal the inflammation and make him breathe a lot easier. Okay.
Carter is exhausted, and Dr. Sinclair promises to return after his nap.
We'll keep a very close eye on him, and I'll pop in again when he's awake. Okay. All right. Thank you. Thank you so much.
Carter is no stranger to Covenant. He was born here and spent over a month in the neonatal intensive care unit. Each time, his parents are impressed by his care here.
They've been very attentive, and the doctors and residents were in numerous times to see him last night, and it was wonderful.
4 weeks old female. So her past medical history is that she's 35 weeks preemie. Her gestational age is 35 weeks. PDA AESD. She was admitted. This is day 7 of RSV bronchiolitis.
A brand new medical student is joining the team for rounding this morning. What they learn here will help patients for decades to come.
Each month we get a resident from the ER program, from the CMU ER program to come in, and this quite often is their only opportunity to really learn pediatrics, and so it's important for them, who sees a variety of patients, that they can really identify the sick kids.
Ava is feeling much better now. It's hard to believe she had to be helped with breathing with a ventilator just a few days ago. Dr. Sinclair says it's amazing how fast children can heal. It's part of the reason she became a pediatrician.
I always felt a connection with taking care of children. I'm a mother myself, and I just found them to be very resilient and fun to take care of, and they never really complain, and they're very grateful, and I like working with the families and being able to have that connection and taking care of kind of the whole family, and knowing I'm a mother myself, how challenging and difficult a time in an ICU could be. So it was really my calling.
Winter can be challenging for pediatricians. It's cold and flu season, and the tiniest of kids are very susceptible to common viruses.
This time of year, especially during the winter months, most of these kids have infectious diseases. Respiratory syncytial virus, or RSV, is kind of the most common one. But at this time of year, any number of viruses can be floating around. So some you just wear the yellow gown, others you have to wear a mask as well. In this one we will be putting a mask on and the gown.
Little Ava traveled from Alpena to get specialized care here at the intensive care unit.
So we have a pretty big catch area, so they're all the way from up in Alpena, and so we take people from pretty much all the way from the tip, just north of Flint. All right, so we'll just wait for the OR time, and then we'll come back and we'll heal, and then time to go.
We'll be out of here tomorrow?
Yes. And because you have to travel pretty far.
Yeah.
Okay. Oh my goodness. Okay, so we'll make sure she's all healed and doing well. Okay. Thank you so much.
Dr. Sinclair finds a teaching moment after a quick listen to Diane's heart.
What did you hear in your cardiac exam? It's very short.
Yeah,
just systolic murmur. It's quiet. It's really quiet. It's probably about a grade 2. Yeah, and probably unless you hear a lot of them, you wouldn't hear it right away.
Baby will have to come back in a few months to have her heart examined again, but she will be just fine.
So it's just followed, so it'll be followed again. They'll repeat an echo, which is basically an ultrasound of the heart. They'll repeat that at 6 months of age. So we just listen and just make sure that it doesn't seem like she's getting any heart failure. But this all seems to be just related to her viral infection.
Viruses could fill every bed here at the PICU.
We have 10 beds, 10 pediatric ICU beds, and what an ICU bed means is that it has heart monitoring capabilities, and so we can watch the patient's heart rhythms and breathing patterns from out here. There is also pediatric beds farther down the hall, whereas they don't have those capabilities, so the less sick kids will go in those rooms.
3 pediatric intensivists work with nurses to heal youngsters from newborns to teenagers. The patients here will get older as the temperature gets warmer.
In the summer, when the weather's nice outside and kids are out riding their bikes, head trauma tends to be a little bit more common. So that's what we see more often in the summer. Diabetes, so diabetic ketoacidosis, tends to occur kind of all year round. We'll have an influx of those. So we're gonna go for a little walk into the MRI. You wanna come see?
Pediatric intensivists also share their expertise in imaging, especially here at the MRI.
This is our big camera. We're gonna have you lay on the table and your head's gonna go right here, okay?
We can use it for various things. Most of the time what we're doing is the MRI of the brain. So if a child has a seizure disorder or we're at all concerned that they may have a tumor or a bleed, we can see it on the MRI machine. A lot of the imaging that they need done, they need to be still for in order to get good pictures and a good diagnosis.
Doctors don't always have to use medicine to keep kids still. These goggles play a child's favorite movie, blocking the sound of the machine and keeping the kid's focus away from the MRI.
Okay, let's have you lie flat.
These goggles have TV screens in them, and they're specially designed to go into the MRI.
The MRI machine itself is a very large magnet, and so anything that's metal can adhere to the magnet and break the MRI machine, which is a very expensive piece of equipment. So that is why it needs to be metal-free.
Good job! Good job!
This works wonderfully. It's a very good distractant, and then with the headpiece on, they're not hearing all of the loud banging sound from the MRI machine. We've had a lot of great success with this. This was a wonderful gift. This is little Lydia. She's coming into our sedation team today to get a CAT scan done of her neck. Quite often they're too little to do it by themselves, and so they need a little help from us with sedation and getting an IV put in.
Special numbing cream is applied where the nurse will put an IV. It will lessen the impact of the poke.
She's just looking at you.
Caregivers know that sometimes needles need to be used to make kids feel better.
I don't think it's something you ever get used to. It's sad seeing them cry and scream and are unhappy. So we try to make them as comfortable as we can. We give them toys to play with. We give them a little sugar water that seems to calm them down sometimes.
Emergency room, and they put the IV in, but she was very dehydrated.
Working with tiny babies is always challenging. Luckily, the experts have some options.
So it depends on what they're having done. Sometimes we can give them an IV and give sedation through there. Other times we put a little medication up their nose and they get a lot more comfortable with that.
It might surprise you to know that not every physician feels this comfortable with babies and kids. Covenant is lucky to have caring doctors who love what they do.
Peds is one of those areas of medicine either you love or it's just not for you. I love sedation days. Yeah.